Dr. Hansol rubbed his tired eyes as he looked at the patient charts on his desk. It was a quiet Tuesday morning at Seoul National University Hospital, and something strange was happening. 3 patients had come in with the same unusual symptoms, small blue crystal-like growths on their skin. "Doctor, we have 2 more cases in the emergency room," Nurse Eun-ho said, walking into his office. She didn't sound worried. After dealing with multiple health crises over the years, it took more than strange crystals to upset her. Hansol stood up and straightened his white coat. "Let's take a look," he said, following Eun-ho to the emergency room. On the way, they passed the hospital's convenience store, where people were buying snacks and drinks like any normal day. In the emergency room, a young man and an elderly woman sat on separate beds. The blue crystals on their arms sparkled under the bright hospital lights. The strange thing was, neither patient seemed to be in pain. "It started this morning," the young man said, pointing to his arm. "I thought it was a rash, but it feels cool to touch." He worked at a local restaurant and was more worried about missing his shift than the crystals. Hansol examined the crystals carefully. They were growing in a perfect pattern, like snowflakes. This wasn't normal. He had never seen anything like it in his 20 years of medical practice. Back in his office, Hansol called his friend Dr. Jae-won, who worked at the Korean Center for Disease Control. "We need to run some tests," he told her. "Something tells me this isn't a regular skin condition." Jae-won arrived within an hour, carrying her testing kit. She had just finished dealing with a minor flu outbreak, and this was just another day at work for her. "The patterns look too perfect to be natural," she said, taking samples from the patients. By afternoon, more cases appeared. The hospital staff handled everything with calm efficiency. They set up a special area for crystal patients, complete with vending machines and free Wi-Fi. Patients sat there, some working on their laptops, others watching dramas on their phones. The evening news reported similar cases across Seoul. Other countries were starting to panic, but in South Korea, people simply added it to their list of things to be careful about. Convenience stores began putting up signs, "Remember to wash your hands and check for crystals." Hansol stayed late at the hospital, studying the test results with Jae-won. The crystals seemed to be spreading, but strangely, they weren't harming anyone. Patients went about their daily lives, just with extra sparkle. "Look at this," Jae-won said, pointing to her microscope. The crystals had a structure unlike anything on Earth. They were changing, adapting, but the changes stopped whenever they met common medicines in the bloodstream. Hansol's phone buzzed. It was a message from the hospital director. "Emergency meeting tomorrow morning. Bring coffee and snacks. Might be a long day." He smiled at the ordinary request during an extraordinary situation. This was how Korea handled crises, with meetings, careful planning, and snacks. Outside his office window, Seoul's lights glowed in the evening sky. People walked down the streets, some with visible blue crystals, most wearing their usual face masks. Food delivery riders zipped past on their motorcycles. A convenience store owner put up a new sign, "Crystal prevention masks. Now, in stock." The world might be facing something completely unknown, but here in Seoul, it was being treated like just another health and safety issue to manage. Hansol gathered his things to head home. Tomorrow would be busy, but nothing they couldn't handle with proper protocols and procedures. After all, they had dealt with health crises before. This one just happened to be sparkly. The morning news showed chaos around the world. In New York, people rushed to stores to buy supplies. In London, the streets were empty. In Moscow, soldiers guarded hospitals. But in Seoul, people lined up quietly at coffee shops before heading to work. Dr. Hansol watched these reports while eating breakfast at his desk. His computer showed emails from doctors worldwide, all asking how Korea was staying so calm. Before he could answer any of them, Dr. Jae-won walked in with a stack of reports. "The whole world is panicking," she said, putting the reports on his desk. "Meanwhile, my mother just texted to remind me to buy kimchi from the store." She showed him her phone. smiling at the ordinary message during extraordinary times. The hospital meeting room was full by 9 a.m. The hospital director, Mr. Doohyun, stood at the front with a presentation ready. "First, let's review our numbers," he said. "Then we'll discuss our new crystal patient care guidelines. And yes, we ordered breakfast for everyone." While they discussed protocols, Han Sol's phone kept buzzing with international calls. A doctor from America couldn't believe Korean convenience stores were still open. A German researcher was shocked that Seoul's subway was running normally. "It's simple," Han Sol explained to them. "We're treating this like any other health issue. Yes, the crystals are strange, but panicking won't help." By afternoon, Jae-won had more test results. The crystals were changing people's skin, but very slowly. "Look at this," she said, showing Han Sol her computer. "Regular hand sanitizer slows them down. They really don't like common medicines." Outside the hospital, life continued as usual. Students went to school wearing crystal-blocking masks along with their regular face masks. Office workers bought anti-crystal hand cream from street vendors. Restaurants put up signs saying, "All surfaces sanitized hourly, crystal-free zone." The evening brought news of other countries closing their borders, but South Korea's response was different. They simply added crystal screening at airports, right next to the temperature checks. Arriving passengers filled out crystal declaration forms along with their usual health questionnaires. Han Sol worked late again, studying patient data. The crystals weren't making people sick. They were just there, growing slowly, almost politely. It was the strangest medical situation he had ever seen. "Doctor," Nurse Yeonho called from the door. "The convenience store downstairs is asking if we want them to stock special crystal care products with our regular medical supplies." He looked up from his work and smiled. "Tell them yes, but let's make sure they're properly certified first. We need to follow procedures." That night, as Han Sol drove home, he passed a street market. Vendors had already made crystal-themed phone cases and cute crystal-blocking mask covers. A food stall was selling crystal-clear soup that promised to strengthen the immune system. His phone rang. It was Jae-won. "You won't believe this," she said. "Other countries are asking for our crystal response protocols. They want to know how we're keeping everyone so calm." "Tell them the truth," Han Sol replied. "We're just doing what we always do, following proper procedures, keeping things organized, and making sure everyone can still get their coffee and snacks." As he parked his car, he saw his elderly neighbor watering her plants. The blue crystals on her arm sparkled in the evening light, but she didn't seem to mind. She just wore garden gloves over them and carried on with her routine. This was how Korea faced the crystal crisis, not with panic, but with paperwork, protocols, and a practical approach to a very impractical situation. The quantum microscopy lab at Seoul National University was quiet except for the soft hum of machines. Song-min, a young researcher, stared at his screen with wide eyes. He had been studying the crystal samples for 3 days straight, and what he saw made him drop his coffee cup. "Dr. Han Sol," he called out, his voice echoing through the empty lab. "You need to see this right away." Han Sol arrived quickly, followed by Dr. Jae-won. They found Song-min pointing at his screen, his hands shaking with excitement. The quantum microscope showed something impossible. The crystals weren't just growing, they were building themselves like tiny machines. "These aren't natural crystals," Song-min explained, adjusting the display. "They're microscopic technology. Look at how they communicate with each other. They're trying to change human cells, but very slowly." Jae-won leaned closer to the screen. "That explains why common medicines affect them. They're machines, not viruses. We've been fighting them the wrong way." While they studied the images, a group of students walked past the lab window, heading to the convenience store. The blue crystals on their arms sparkled under the fluorescent lights. They were laughing about something on their phones, completely unconcerned about their sparkly passengers. "Wait," Song-min said suddenly. He rushed to his desk and grabbed a bottle of cold medicine. Yesterday, I had a headache and took some medicine. An hour later, the crystals on my arm stopped growing. I thought it was just a coincidence, but look at this. He put a drop of common cold medicine on a crystal sample under the microscope. The tiny machines immediately slowed down, as if they were struggling to work. They're not prepared for our medicines, Hansol realized. These machines were designed to change human biology, but they can't handle simple cold medicine. It's like trying to run complex software on an old computer. Jai-1 quickly made some calls. Within an hour, the lab was full of researchers, all watching as Song-min repeated his experiment. The alien technology that was supposed to transform humanity was being stopped by basic cold medicine that cost less than a cup of coffee. Outside the lab, Seoul continued its normal routine. Street vendors sold hot food to students. Office workers hurried to meetings. The only difference was the new signs in pharmacy windows. Cold medicine, now with crystal protection. Hansol spent the afternoon filling out paperwork. The discovery meant new forms, new protocols, and new guidelines. He had to submit everything in triplicate, following proper procedures even for alien technology. Other countries are starting martial law, Jai-1 said, reading news on her phone. Meanwhile, we're filing paperwork about alien machines like it's a new type of flu. Song-min, still excited about his discovery, was already writing a research paper. Should I list the alien technology under foreign organisms or external factors in the documentation? He asked, following the standard research paper format. By evening, pharmacies across Seoul had updated their inventory systems to mark cold medicines as crystal management solutions. The hospital gift shop started selling alien technology resistance kits next to the Get Well Soon cards. Hansol looked out his office window at the city lights. Somewhere out there, someone or something had tried to start an apocalypse. Instead, they had run into Korean medical bureaucracy and lost to over-the-counter cold medicine. He smiled as he filled out another form. The end of the world had come to Earth, and Korea had turned it into a paperwork problem. Na-young sat in her office at Korea's largest pharmaceutical company, reviewing the latest test results. The modified cold medicine was working better than expected. On her desk, several bottles of the new crystal-clear medicine waited for final approval. Her phone rang. It was Dr. Hansol from the hospital. "The paperwork is complete," he said. "We can start mass production as soon as the quality control team gives their approval." Na-young looked through her office window at the production facility below. Workers in clean suits were already preparing the manufacturing lines. The crystal situation had created the biggest product launch in company history, but everyone treated it like a routine project. In other countries, people were building underground shelters. But in Korea, companies were competing to make the best crystal-blocking products. One company had already released face masks with a special crystal-resistant layer. Another was selling crystal-blocking hand sanitizer that smelled like green tea. Na-young's assistant brought in more reports. The crystal-blocking products needed proper certification, just like any other medical supplies. That meant more paperwork, more tests, and more meetings. The Convenience Store Association called again, her assistant said. They want to know when they can start stocking the new products. Also, the subway stations want to install crystal medicine vending machines. In the research lab downstairs, scientists worked on improving the medicine formula. They had discovered that adding vitamin C made the crystal blocking effect last longer. One researcher had even created a crystal blocking cream that doubled as sunscreen. Dr. Jai-1 visited the facility that afternoon for inspection. She walked through the production line, checking that everything followed proper safety protocols. "Other countries are asking how we're managing this so well," she told Na-young. "They can't believe we're treating alien technology like a seasonal health issue." Outside, street vendors had adapted quickly to the situation. They sold crystal-blocking face masks in pretty designs. Some shops offered special crystal care packages that included medicine, hand sanitizer, and a trendy mask. Everything needed proper certification, of course. Nayoung spent the evening in a video meeting with international health organizations. They wanted to know how Korea had developed crystal management solutions so quickly. "We just followed our usual procedures," she explained. "We identified the problem, developed a solution, and filed the correct paperwork." The manufacturing facility worked through the night. Workers checked quality control sheets and prepared shipping documents. Everything had to be perfect before the products could leave the factory. By midnight, the first batch of crystal clear medicine was ready. Nayoung watched as workers packed the bottles into boxes. Each box had proper labels, safety information, and a QR code linking to the product website. Her phone buzzed with a message from Dr. Hansel. "Medicine approved for distribution. Please ensure all products have proper warning labels and usage instructions in multiple languages." Nayoung smiled as she signed the final approval forms. Somewhere in space, aliens had probably expected their crystal technology to cause chaos. Instead, it had become another product line, complete with customer service support and a user manual. The next morning, convenience stores across Seoul put up new signs. "Crystal management products now available. Please ask staff for assistance." The apocalypse had become just another item on store shelves, waiting for customers between the cold medicine and the hand sanitizer. The morning started like any other at the Korean Center for Disease Control. Dr. Jae-won was reviewing crystal infection rates when her computer screen suddenly turned blue. Strange symbols appeared, then changed into Korean text. "Request for emergency medical consultation." She treated it like any other medical emergency. She filled out the proper forms and sent them to Dr. Hansol and Nurse Yeon-ho. Within an hour, they gathered in the meeting room, ready to meet their unexpected visitors. The aliens arrived in what looked like protective suits. They appeared confused when they saw the calm faces of the Korean medical team. Their leader, who introduced himself as the Emergency Response Director, spoke through a translator device. "We do not understand," the alien director said. "Our transformation protocol is failing. How are you managing this situation without panic?" Nurse Yeon-ho was already pouring coffee for everyone, including the aliens. Dr. Hansol opened his laptop and started a PowerPoint presentation titled "Crystal Management Protocols and Implementation Guidelines." "First, please fill out these visitor registration forms," Jae-won said, handling the aliens some papers. "We need to follow proper procedures before we begin the consultation." The aliens looked at each other in confusion but took the forms. Their translator device struggled with terms like previous medical history and emergency contact information. "Your bioweapon is being effectively managed with common cold medicine," Hansol explained, showing graphs and charts. "We've already developed improved versions and implemented distribution systems." The alien director dropped his translator device in surprise. "Cold medicine. But this is advanced transformation technology. It took us centuries to develop." "Yes, and it's very impressive," Jae-won said politely. "But you didn't account for Earth's medical bureaucracy. We've had to deal with various health crises before. We have systems in place." Outside the meeting room, office workers walked past, glancing curiously at the aliens but continuing their work. Someone had put up a sign, "Interplanetary medical consultation in progress. Please keep noise level down." The aliens watched in amazement as Yeon-ho showed them the hospital's crystal management procedures. "See, we've added crystal screening to our regular health checks," she explained. "Patients can book appointments online or through our mobile app." "But this was supposed to be an apocalyptic event," one alien said, still confused. "Instead, you're selling crystal-blocking products in convenience stores." Hansol nodded. "We find that making health solutions convenient helps with public compliance. Would you like to see our customer satisfaction surveys?" The alien director looked at the graphs showing how crystal infection rates had stabilized. Then he looked out the window at Seoul's busy streets, where people went about their day wearing crystal-blocking masks along with their regular face masks. "We may have miscalculated," he admitted. "Earth's medical infrastructure is more robust than we expected, especially here in Korea." Jai-1 was already preparing documentation for international health organizations. Would you be interested in consulting on proper crystal management techniques? We should share this knowledge globally. By the end of the meeting, the aliens had signed cooperation agreements and received visitor badges. The apocalypse had turned into a medical consultation, complete with scheduled follow-up meetings and action items for review. The alien warship hovered above Seoul, but not as a threat. The Koreans had converted it into a temporary medical conference center. Meeting rooms replaced weapon stations, and the ship's cafeteria now served both human and alien refreshments. Do-hyun, the head researcher, stood at the podium in the main conference room. Behind him, his presentation displayed a detailed analysis of Earth's medical history. The alien audience watched intently as he explained how humans had been fighting microscopic threats for thousands of years. As you can see from these charts, Do-hyun said, pointing to his slides, Earth has extensive experience with pandemic management. Your crystal technology, while advanced, followed patterns we've seen before. The alien scientists took careful notes. Their earlier embarrassment about their failed invasion had turned into genuine scientific curiosity. One alien raised a hand, following the meeting etiquette they had learned. But how did you maintain normal operations during a crisis? The alien asked. Our simulations predicted total social collapse. Dr. Hansel, sitting in the front row, stood up to answer. We have procedures for everything, he explained. When something new appears, we create new procedures. The crystal situation simply became another item in our health and safety guidelines. In another part of the ship, Dr. Jai-1 led a workshop on Earth's medical bureaucracy. The aliens learned about approval processes, safety certifications, and the importance of proper documentation. They seemed amazed that paperwork could be more resilient than advanced alien technology. Your invasion plan had one major flaw, Jai-1 explained. You didn't file the proper permits for planetary transformation. Without approved documentation, we had to treat it as an unauthorized medical condition. During lunch break, alien and human medical professionals shared meals in the ship's cafeteria. The aliens tried Korean food while discussing different approaches to public health. Some aliens had become particularly fond of convenience store snacks. Nae-young presented the latest crystal management products to a group of alien biochemists. They studied the simple cold medicine that had defeated their complex technology. One alien actually applauded when she showed how the medicine could be bought from vending machines. Your distribution system is remarkable, the alien biochemist said. We spent centuries developing the crystals, but you made the solution available everywhere within weeks. Later that afternoon, Song-min demonstrated how Korean face masks had evolved to handle various health challenges. The aliens took samples of every mask type, amazed by the combination of practicality and fashion. As the day ended, Do-hyun prepared the meeting minutes. The aliens insisted on following proper Earth business procedures, including scheduling follow-up meetings and creating action items. They had even started using human calendar apps to manage their schedules. We should organize regular health and safety seminars, an alien suggested during the closing remarks. Our species could learn much from Earth's medical infrastructure, especially Korea's systematic approach. The day concluded with both species signing a medical cooperation agreement. The document included sections on knowledge sharing, technology exchange, and proper protocols for any future planetary transformations. Everything had to be submitted in triplicate. Of course, Dr. Jai-1 stood at the podium, in the World Health Organization headquarters in Geneva. The large screen behind her displayed Korea's crystal management protocols. Representatives from every country watched as she explained their systematic approach to handling the alien health situation. The key is treating it like any other public health matter, she explained, showing slides of Korea's success. We've prepared detailed guidelines that any country can follow, complete with proper forms and procedures. In the audience, health ministers nodded with increasing understanding. The panic of the early crystal days had given way to professional interest. They took notes as Jai-One explained how convenience stores could become crystal management centers. Dr. Hansol sat in the front row, preparing for his presentation on hospital protocols. He watched as other countries began to understand what Korea had known from the start. Even alien technology could be managed with proper procedures. "Your nation turned a potential apocalypse into a public health initiative," said the German health minister during the question session. "How do we implement this system in other countries?" Jai-One clicked to the next slide, showing a step-by-step implementation plan. "We start with proper documentation," she explained. "Then we set up distribution networks for crystal management products. Every step must follow approved procedures." Around the world, countries began adopting the Korean model. New York convenience stores started selling crystal-blocking products next to cold medicine. London pharmacies set up crystal screening stations. Even Moscow's subway stations installed crystal medicine vending machines. The alien representatives attended every session, taking careful notes. They had become unofficial consultants, helping other nations understand both the crystal technology and Korea's management systems. "We never expected Earth to have such effective health infrastructure," an alien health officer admitted during a coffee break, "especially not one that could be implemented worldwide." Training sessions continued throughout the week. Naeum taught pharmaceutical companies how to mass-produce crystal management products. Song-min showed research teams how to monitor crystal adaptation rates. Everything followed strict quality control standards. In the evenings, Dr. Hansol helped write an international crystal management handbook. It included sections on proper paperwork filing, emergency procedures, and even customer service guidelines. The aliens requested extra copies for their own medical archives. Back in Seoul, life continued as usual. The crystal situation had become just another part of daily health management. Other countries now sent their medical staff to Korea for training, learning how to maintain normal life during unusual health situations. "The most important thing," Jai-One told the international audience, "is to remember that panic never helps. Good procedures, proper documentation, and easy access to treatment. These are what make a health system work." By the end of the week, every country had received their implementation packages. The packages included procedure manuals, proper forms, and guidelines for setting up crystal management infrastructure. Everything came with clear instructions and helpful diagrams. The aliens watched in amazement as their apocalyptic technology became part of Earth's routine medical care. They had tried to transform the planet, but instead found themselves learning from it. As one alien noted in the feedback form, "Earth's medical bureaucracy is more impressive than any weapon we could have designed." 1 year had passed since the crystals first appeared. Dr. Hansol sat in his office, reviewing the annual crystal management report. The blue crystals on his arms sparkled as he typed, a common sight now in every country on Earth. The hospital lobby had changed little, except for new signs that read "Crystal Care Center" next to "Flu Shot Available Here." At the reception desk, people filled out combined health check forms that included both regular symptoms and crystal status updates. Naeum's pharmaceutical company had just released their newest product, a combination cold and crystal medicine that came in pleasant fruit flavors. The advertisement showed a smiling family wearing crystal-blocking masks with the slogan "Protection for All Seasons." Dr. Jai-One walked into Hansol's office carrying fresh data from the global crystal monitoring system. "The aliens just sent their quarterly satisfaction survey," she said. "They're still amazed by how well everything worked out." The alien representatives had become regular visitors to Earth's medical conferences. They had offices in major hospitals worldwide, where they helped monitor crystal developments and learned about human healthcare practices. Their warship, permanently stationed above Seoul, now served as an international medical research center. In convenience stores across the world, crystal management products sat naturally between the cold medicine and hand sanitizer. The store clerks helped customers choose between different brands, just like they did with any other health product. "Remember last year?" Song-min asked during the afternoon staff meeting, when everyone thought it was the end of the world. He was now heading the Crystal Research Department, though he spent most of his time filling out research grant applications. The aliens had officially renamed their invasion plan to Unintended Healthcare System Upgrade Initiative. They now sent medical students to Earth to study how humans managed public health issues. Korean hospitals had special alien internship programs, complete with proper certification processes. That evening, Hansol finished writing his paper, 1 Year of Crystal Management, a case study in practical approaches to extraterrestrial health issues. The paper had already been accepted by major medical journals on both Earth and 3 other planets. At the hospital entrance, a new sign showed updated crystal season forecasts next to the weather report. Parents checked these forecasts when planning their children's outdoor activities, just like they checked for high pollen days or air quality warnings. The alien director, who now worked as a healthcare consultant, often said that failing to invade Earth was the best thing that had ever happened to their medical science. "We came to transform your world," he would say during lectures, "but instead, you transformed our understanding of healthcare management." As Hansol packed up to go home, he looked at his calendar. Tomorrow he had a meeting about improving crystal-blocking mask designs, then lunch with alien medical researchers, and finally a regular checkup for his own crystals. Just another normal day in the post-invasion world. Outside his window, Seoul's evening lights glowed as usual. Food delivery riders zipped between cars, their crystal-blocking gear glowing softly in the dark. In a nearby convenience store, a clerk restocked the crystal care shelf while humming a popular song. The apocalypse had come and gone, defeated not by weapons or warfare, but by systematic procedures, proper documentation, and the unshakable human ability to make the extraordinary ordinary.